Williams, and I'll be talking to you today about the flu, its symptoms, and techniques for prevention. According to the CDC, an average of 200,000 people are hospitalized each year due to the flu and its complications. Knowing the flu symptoms and techniques for its prevention can help stop its spread and reduce this number. In addition to those hospitalized each year, flu accounts for 31.4 million outpatient visits and 3,000 to 49,000 deaths. In comparison, car crashes are responsible for 34,000 deaths a year, so almost as many people are killed in car crashes as in flu-related deaths. $10.4 billion are spent out each year in medical costs, and those infected with the flu lose $16.3 billion in earnings and wages. The flu season peaks each year in January, and unfortunately it changes over the course of seasons. Individuals lose immunity over time to the flu. This is why the CDC monitors the flu closely year-round in comparison with U.S. partners and international partners to help find new methods of treatment and prevention. Flu symptoms include a fever over 100 degrees Fahrenheit, chills, body aches, headache, feeling weak or tired, and chest discomfort. Chest discomfort is the only common symptom between the common cold and the flu. Those typically confuse common cold symptoms of runny or stuffy noses, sore throats, and sneezing to be flu symptoms. However, this is in fact false. Flu is spread by tiny droplets projected when people cough, sneeze, and even just talk. Individuals are contagious with the flu 1 to 4 days after illness has onset and up to 1 day before their symptoms actually even appear. The CDC recommends flu vaccines each year as the first line of defense against the flu, and it's recommended that those eligible to receive the vaccine receive it by the end of October. However, as long as the flu is still circulating, it's not too late to get your vaccine. Those at high risk for developing the flu include children less than 5 years of age, adults 65 and older, pregnant women, residents of long-term care facilities, and those with other medical conditions such as asthma, obesity, and heart disease. Anyone older than 6 months of age can receive the flu vaccine, and it's often recommended that children up to 8 years of age receive 2 doses of the vaccine. The first should be as soon as the flu vaccine is available, and the second should again be by the end of October. If you do experience flu symptoms, you should stay home until you're fever-free for at least 24 hours with no fever-reducing medication such as ibuprofen or acetaminophen. Avoid contact with people, rest as much as possible, and drink fluids. Antivirals such as Tamiflu can also be used as the second line of defense against the flu. However, these medications are only available to those that report and are prescribed by their physician. These medications up to 48 hours after the onset of symptoms. Covering your nose and mouth with tissues when you cough or sneeze and immediately disposing of these in a trash can also help contain the flu germs, and washing your hands with soap and water as often as possible can help. If soap and water is not readily available, you can use alcohol-based hand sanitizers. Also, contact your medical team within 48 hours of your symptom onset to inform them of your flu symptoms. Please seek treatment immediately if you have severe symptoms such as shortness of breath, wheezing, coughing up blood, pain or pressure in your chest, trouble with balance, walking, sitting up, or confusion. In the 2012-2013 flu season, 45% of the population was vaccinated, and this was responsible for preventing approximately 6.6 million flu infections. The CDC provides interactive, real-time tracking of your area for the flu so that it's on their website so that you can see where your area stands in reported flu infections. Remember, as long as the flu is circulating, it is never too late to receive your vaccine. Protect yourself and your loved ones by practicing flu prevention. Thank you.